Hi, Chris here again with a quick update on my prostate cancer recovery. Now, for all of you men and caregivers out there that are watching this series, I've struggled with this latest update because I hope that you are encouraged by my video series. I've had a really good recovery thus far. I've been able to overcome the two main side effects of prostate removal because I did have my prostate removed in February of 2018. Those are incontinence and erectile dysfunction. I'm able to manage both now at this point. And I posted maybe a couple months back that I was 100% cancer free. I posted that because we started to see a decline in my overall PSA level. Although it wasn't undetectable, I was trending downward. However, in my last PSA test, it did go back up. It actually went up to 0.23, which was almost double what my PSA level was following surgery. And it was what my doctor considers an actionable level. So I was struggling with sharing this because I don't want men to be discouraged that you go through surgery and you may need additional treatment. It was definitely something that the doctor had always talked about. And in fact, after surgery, he gave me the option to have radiation just as a safeguard to ensure that we did remove all the surgery, or he gave me the option to wait and just monitor it through the PSA level. So I was monitoring through the PSA level. We did a few tests. We did 3 tests. And I didn't make it a year and decided to go ahead and have the radiation post-surgery. Now, the radiation itself was the easy decision. The side effects are minimal. It can be urgency to have bowel movements, to urinate, and a bit of fatigue. The way they describe the fatigue is a little bit run down in the afternoon after working all day, but nothing that should put you down and out. So that was fairly easy. The more difficult decision was to pair that with a hormone suppressant. The side effects of hormone suppressant, as they've been communicated to me, are potentially, and that's the key word, potentially, it doesn't happen to everyone, is mood swings, hot flashes, night sweats, loss of muscle mass. It's basically a male menopause. You're taking testosterone levels down to 0. Now, I'm only having a 3-month dose, which was what my doctor recommended, and it should be effective for about 6 months, because after the shot wears off, it takes several weeks, months for that testosterone level to gradually get back to where it was. I had my shot 2.5 weeks ago, which is usually when you start to see the symptoms set in, and knock on wood, I haven't seen any of those side effects just yet. So maybe I'm one of the fortunate ones that won't see those side effects. But I did choose to go ahead and have the shot because 6 months in the grand scheme of things is nothing, right? If it's going to increase my chances of the radiation to be more effective and to get rid of this cancer once and for all, I'm going to do it. Another factor was that it is only a 3-month shot, right? It's not something that I have to be on long term, and some men, depending on their particular case, that is their course of treatment. They are suppressing their testosterone, which is the fuel for prostate cancer, for longer durations, and that tends to have different long-term side effects. So went ahead and had the shot, and we'll see how the side effects go. But the main reason to do that is the doctor indicated that studies are now showing that it greatly increases the effectiveness of the radiation in his mind if you had the hormone suppressant at the same time. So that's what I chose to do. So it's not a bad update in any way. I hope that if you're watching this and you're going through your own prostate cancer journey, or you are a caregiver of someone who is struggling with prostate cancer, I don't want to discourage you from looking into the prostate removal. I have 0 regrets that I had the prostate removed. I think it's the best course of action for me. given my age and health and all other factors. The way that I look at it is we got the majority of the cancer out as part of surgery. There are some cancer cells that remained behind, probably because we saved all of my bladder neck and all of my nerves, which allow for better continence, I should say, and it also allows me to continue to have erections by sparing those nerves. On the downside, by leaving that stuff behind, that's where you kind of increase your risk that some cancer cells are left. And that's probably what happened in my case. But we're gonna get it as part of this radiation. And in January, we'll finish up that treatment. 3 months later, so around beginning of April, I hope to have my very first clinically undetectable PSA level back. So I'll keep you posted. As always, if you have questions or comments, please leave them below and I'll do my best to answer. Thank you so much.